Good afternoon. Hello, everyone. Welcome to our COVID-19 update for January 25th. I'm Mark Polenkars, joined by Karen Gambino from Deaf Access Services. You'll hear from Dr. Gail Burstein in a short period of time. We have some information to announce, some of it which is good, some of it which is really bad, but let's get right into it. The data summary for yesterday, there were 726 new cases that were confirmed yesterday by the Erie County Department of Health, a positivity rate of 14.4%. To give you some comparison, the prior Monday, the positivity rate was 20.4%, and there were 1,436 new cases, so it basically dropped in half. And the prior Monday, the positivity rate was 27.2%. and 2,534 new cases. So we're seeing a big drop in new cases, and we're thankfully seeing a big drop in the positivity rate as well. It's basically half of where it was 2 weeks ago on this day. And we can confirm that 6% of Erie County residents have a lab-confirmed positive COVID-19 test in the past 4 weeks. So 6% of all Erie County residents we know have a confirmed lab test. That does not include any individuals who may have done a at-home test and did not report it, because you can report that now. So there's over 200,000 individuals who have tested positive for COVID-19 since the beginning of the pandemic. That's roughly 1 in 5 residents in Erie County. So last week, or through January 22nd, there were 8,431 new COVID cases. This is a 47% decline compared to the previous week, which was 16,103 cases in a week. And it's the second consecutive week we've had a decline. The weekly positivity rate dropped to 17.1%, down from 23.5% the week before, 24.8% the week before that. However, the case rates and positivity rates, while they've decreased, are still very high. So I think we need to note that. It's great to see a decline of 47% in cases, but there were over 8,000 new cases last week. And the positivity rate is still very high. If we were talking about 15% positivity rate early in the pandemic, I think we all would have been shocked, because the rates were, when we were shut down, weren't nearly that high. And the diagnostic tests, they did 49,000 plus in the prior week. That's down from 68,000. That's why the positivity rate's a very important number to look at. The overall case rate on a 7-day period is very important to look at, because that's a better comparison than just the raw numbers. Hospitalizations. We're happy to say hospitalizations of COVID patients continue to drop, at least for those who are admitted for COVID-19. On January 23rd, there were 475 patients in total in Erie County hospitals who were COVID-19 positive. 267 of them were admitted for a COVID-19 related illness. So 44% of those 475, or roughly, is it 257 patients admitted for COVID, or 267 admitted for COVID, 208 admitted for another issue. Could have been a car accident, could have been an injury, could have been there for some sort of surgery. But the numbers are going down. That's a positive. The hospital bed capacity, while we're seeing drops in COVID patients, has not necessarily dropped that much. It has dropped. That's important. Total beds occupied on January 23rd, 87% of all beds. There are some hospitals in which their beds may be full. ECMC is a good example of it. Their acute care beds have been full for quite some time now. They're basically churning through hospital patients, discharging others, and new ones come in. ICU beds are dropping. They're down to 80%, but still a lot of people in the intensive care unit in Erie County. And you'll see that bottom line on the picture is the deaths. We've had a lot of deaths in the last 2 weeks, and we'll talk more about that now, because we can confirm from the Department of Health that 105 COVID-19 associated deaths among Erie County residents occurred between the period of January 7th through January 20th. These are individuals who died from COVID-19. These are not individuals who had a car crash and were COVID-19 positive but died from the car crash. Now, 58% of those individuals were not fully vaccinated prior to infection. That is still considered 2 shots for the Pfizer and the Moderna, 1 shot for the Johnson & Johnson. Does not include the boosters, but we'll talk more about that. But of the 105 people who died between January 7th and January 20th, 5 were under the age of 40, none of whom were fully vaccinated. So they had not gone through the 2-shot regimen for Pfizer or Moderna or 1 shot for Johnson & Johnson. The average age of the fully vaccinated persons who died was 78. The average age of the persons not fully vaccinated were 70. Now, I've talked about this repeatedly. The numbers show that if you are vaccinated, and now we have numbers related to boosters, you are protected at a much higher rate than somebody who's not. I believe the CDC released that you are protected from serious illness or death 68 times more than someone who's unvaccinated if you've been vaccinated and boosted. But we can say since this, November 1st of 2021, 420 Erie County residents have died from a COVID-19 related illness. Only 8.3% of those individuals, or 35 individuals, were in persons who were fully vaccinated and boosted prior to infection. However, of those 35 individuals, 22 of those were age 80 or older, and the vast majority of the rest of them were in their 70s. 13 deaths have occurred in people who were fully vaccinated and boosted under the age of 80 since November 1st. That is 3% of the entire total deaths. So we've had 420 people who've died in Erie County since November 1st. We can note that 13 people under the age of 80 have died since then of that 420 people who were fully vaccinated and boosted, 3%, and those, as I noted, most of them were in their 70s. The vaccination and the booster protects against serious illness and death. It's as simple as that. 5 people under the age of 40 died in a 2-week period in Erie County, and they were not fully vaccinated. They should be here today. I offer my deepest condolences to all the family members and others who've lost a loved one as a result of COVID-19. More mortality data. This is looking at it for the month of January through January 20th. 134 people have died in the month of January, 6 under the age of 40, 6 under the age, or between the ages of 40 and 49. More people have died under the age of 40 during January of 22 than any other month during the previous month during the pandemic. The previous high was 5 in April of 2020 when the pandemic just started. So 6 people died so far in the month of January under the age of 40. And as I noted, 5 of those were not fully vaccinated. I'm not certain about the 6th. I don't have that data in front of me right now. But 12 persons died under the age of 50 in January 22, tying April 21 as the highest month of deaths for those age categories. 6 people under the age of 40, 6 between 40 and 49, 12 people have died under the age of 50 in the month of January. And just to take a look at the previous years, 1,276 people died in the 2020, 1,117 died in 2021, and now through 2022, through January of 2022, 134 people have died in Erie County from COVID-19. This is not someone with a gunshot wound who was COVID positive. This is not people who were in car crashes. These are individuals who died from COVID-19. And it's sad because if you just look at the numbers, we're not where we were, thankfully, last January, but we have the vaccine now. We should not be seeing as many deaths. And if you look at it, last January, the average age of death was 81 in Erie County. And right now, the average age of death for the month of January is 72. There are people in our community who should be alive today but are not because they were not vaccinated. I can talk till I'm blue in the face. Dr. Burstein can talk till she's blue in the face. Please talk to your family members, get them vaccinated. It's as simple as that. The vaccination status through January 24th, 324,000 booster doses have been administered among Erie County residents. That's great, but we still have about 200,000 other people who could get a booster, so we need more people boosted. The graph you see on the screen are those who have one shot, and you'll note the declining numbers as you get under the age, or the age range of 34 and under especially, but we could do better. We must do better. There are people, as I said, who are dying in this community who have not been vaccinated, who should be alive today. I've seen a couple of their obituaries. I don't know these people personally, but I know some of their loved ones who've lost a loved one, and I know their loved ones are going through terrible times right now because they lost a family member who should be alive today. Yesterday, a state Supreme Court judge in Nassau County issued a decision determining that New York State's mask mandate as issued under New York State Executive Law Section 29A was unconstitutional. The New York State Supreme Court, just for people's knowledge, is not the highest court in New York State. It is actually the lowest trial level, but it still could have an impact on the rest of the state. But it is not like the U.S. Supreme Court. Actually, in New York State, the highest trial court is called the Court of Appeals. The middle section is the appellate division. Below that are the state Supreme Court. So this was a state Supreme Court judge in Nassau County ruling on the constitutionality of the action that was entered into by the Department of Health from New York State in regards to a mask mandate statewide. Using and looking at New York State Executive Law 29A, the judge ruled the action unconstitutional. I've read the decision. I'm an attorney by trade. There's nothing in the decision that affects local emergency orders. There's nothing in the decision that affects New York State Executive Law Section 24, where counties and other local governments derive their powers. So the mask and vaccine mandate in New York City, that is still valid. The mask mandate in Erie County, it is still valid. The judge's ruling has no effect on any local government emergency order. It only affected the state's decision. So there's been a lot of questions. Well, what does this mean for Erie County? And what it means is, because we've continued it since I instituted on November 23rd, the emergency order in regards to emergency masking requiring all patrons and public-facing staff in indoor locations to wear masks is still in effect. It has not been ruled unconstitutional, and the decision by the judge does not affect it at all because it was based on a totally different part of the law. The judge did not rule on the mandate as being unconstitutional. The judge ruled on the process that was used by the state administration to enforce and pass this requirement. So the mask requirement that I issued and Dr. Burstein issued through a commissioner order on November 23rd is still in effect today. It has never gone out of effect. New York State created a stricter mask mandate, but our original mask requirement is still in effect. So therefore, you have to wear a mask when you're indoors and you're in a public-facing location in bars, restaurants, hotels, barbershops, beauty parlors, bowling alleys, schools, office complexes, shopping centers, malls, stores, and any other location that is open to public, including governmental buildings. We have this rule, and right now I'm physically separated by the other people in this room. Otherwise we're wearing masks, and this rule is in effect so that people can understand that if you're working at your desk and you're alone, you don't need to wear a mask. But if you're working at a desk and people are coming straight to you and you're talking with members of the public, the rule is you have to wear your mask if you can't otherwise safely socially distance. That's the rule that we implemented in November, and it is still in effect. It has not gone out of effect since the state did what it did. It is my understanding the Attorney General's office for New York is already appealed or is in the process of appealing the decision that was entered in Nassau County yesterday, and that is okay. That's the rule of law. The rule of law says a Nassau County Supreme Court judge made this rule as it affects New York State. It does not affect the impact of local government orders. It's quite clear. I know there's a lot of people who are saying that is not the case, but you have to rule on the particulars associated with the decision in the law. And this decision was in regards to how this was processed under New York State Executive Law Section 29A, which does not affect local governments. It affects the governor's ability to issue an order. Local government's ability to issue a state of emergency and emergency orders are based on New York State Executive Law Section 24. They are different. It has a different impact. So I want to make that clear. The mask order is still in effect for Erie County. It has never gone out of effect. Now that a decision has been rendered with regards to the state rule, while that is being decided in a state court, the county rule is still in effect. And with that, I'm going to turn it over to Dr. Burstein.
Thank you. Good afternoon. So I just want to be clear that, given that Omicron is the dominant COVID-19 variant in our community, boosters save lives. Their data that the county executive just presented, their data that were recently published in CDC's MMWR, their data that were recently published in the American Medical Association's JAMA journal that show that the boosters are very effective at preventing severe illness, hospitalizations, and death due to COVID-19. So anybody who's been fully vaccinated, I applaud you, but you have to get a booster. Boosters save lives. And in Erie County, we have many opportunities for people to get vaccines. You can go on our website at erie.gov/vax, V-A-X, to see when and where is most convenient for you to get a booster dose. If you haven't started your series yet, or you need one more dose and then you'll be eligible for your booster, get that now. Time is at the essence. The clock is ticking. There are people dying every day, as the county executive has showed you. So we really need to do everything we can to keep as many people healthy and happy and safe during this pandemic. And even though the numbers are decreasing, we're still seeing deaths, and that is a reality. And boosters are our way out of that. So if you don't want to go out to a vaccine clinic, I know the weather is pretty crummy, you can get a vaccine at home. Again, call us at 716-858-2929. We'll get your information. We'll give it to Buffalo Home Care, and they will contact you and to make a plan to come over to give you and anyone in your household a COVID-19 vaccine. Any available vaccine, any dose that you need. If you want other options, you can go onto the federal government's vaccines.gov website to see where else vaccines are being offered. And also talk to your healthcare provider. Many providers' offices are offering COVID-19 vaccines. So please, get vaccinated, get your booster if you haven't already been boosted, if you are eligible. Also, we are offering COVID-19 testing free. Erie County Health Department's Public Health Lab offers the state-of-the-art, most sensitive COVID-19 diagnostic tests available in the United States. I'm sure that you've had experiences, either yourself or friends or family, where you know people that have said, oh, I tested negative with my home rapid test, but I had symptoms, so I just wanted to check it out. I got a PCR test or an ID Now test, and that was positive. Erie County Health Department offers the most sensitive and specific COVID-19 diagnostic tests. I also know people who didn't have symptoms, they were low risk, did a home test, it was positive, and that ended up being a false positive. So again, it's really important to know your status with the most sensitive and specific test available. So our public health lab is running tests pretty much every day of the week. We have visits for testing open every day of the week. It's free for Erie County residents. Just call us at 716-858-2929. We have good availability right now. You often can get a same-day appointment. We have evening hours, we have weekend hours, and we're turning around those tests pretty quickly. Many people get their results within 24 hours, if not, then 48 hours. So please give us a call and get your test. It's very important to know your status. That's part of the piece of the puzzle to stop transmission. And with that, I'm going to turn it over to the county executive for questions.
Thank you, Dr. Burstein. Before I take questions, I just want to note, we all want this to end. I want this to end. we all want to get back to what we consider normal life. I believe COVID's going to be with us for the rest of our lives in some form. That doesn't mean that we're going to be following the same mask rules and things like that in the future. Remember, the mask order was put in November to protect our hospitals from getting inundated and overfilled with patients, and they've barely hung on. The bed capacity rate right now is a little less than 90%, 80% in the ICUs, but there were times in which it was 95% of every bed in Erie County was full. We implemented the mask mandate to ensure that our hospitals didn't drown with patients. The COVID numbers are going down. I'm happy to see that. The COVID hospitalizations are going down. I'm happy to see that as well. And if things continue in this trend, there's a possibility we'll be able to lift the mask requirement in February. But we're just not there yet. There are still people dying. Most of them, those individuals, are unvaccinated, especially if they're under the age of 60. And I just ask everyone to bear with us here. Talk to your friends and neighbors, family members who work in a hospital, and they'll tell you how stressed they are. The mask mandate was not put in place to make people's lives miserable. It was to prevent our hospitals from drowning in COVID patients. It worked during the Delta wave. We brought the numbers down, and then Omicron hit. And we saw a ridiculous number of new cases. But thankfully, because of the percentage of people we have vaccinated in our county, the vast majority of those individuals had very minor cases, if they even noticed it at all. But some people have very, very sick cases, such that they require hospitalization. Some individuals don't make it out of the hospital alive. 105 of our fellow county residents died between January 7th and January 20th. And as I noted, 5 of those individuals were under the age of 40, in the prime of their life, and they should be here today, but they're not. We still need to take this serious. It's not going to be something we're going to have to react to forever, but we're still seeing high numbers. And as those numbers go down and the hospitalizations go down, we'll relook at the numbers, and if we believe it's now safe to lift the mask mandate, we will do so. We do not want to keep it on forever. This is entering an endemic. It's leaving the pandemic and it's becoming endemic. I expect on an annual basis we'll be having to get a booster shot, just like we have to get a booster shot for the flu on an annual basis. And that shot protects you from serious illness and death. None of us want to deal with this for the rest of our lives, but we're probably going to have it in an endemic soon enough. And so we need to get through this Omicron wave and then look back and say we did all we could to ensure we saved the most amount of lives in our community, and we helped those incredible people who've worked in the hospitals for almost 2 years now during this terrible pandemic. Keep them from understanding that they don't have to go in every day and see hundreds and hundreds of patients there for COVID. That's what we're trying to do by having the mask requirement in place. Prevent our hospitals from drowning in COVID patients such that when you're injured or you're sick with something else, you can't get the care you need because the beds are full with COVID patients. That's why we've taken this action. And with that, I will open it up to questions, starting with WKBW Channel 7, Jeff Russo.
Good afternoon, County Executive. Appreciate the time. When you talk about the possibility, and you said we're not there yet, but when you talk about the possibility of perhaps being able to remove that mask mandate, what kind of threshold are you looking at for that? Or do you have in mind where you want the numbers to